Hi loves, welcome back to my channel, Uniquely Blessed. If you are new, my name is Sharna. I am currently pregnant with my baby boy and I have a 1-year-old daughter named Shania. And in this video, we are going to be talking about my week 30 to 32 week pregnancy update. I'm sorry. One of my symptoms is I forget a lot. I've noticed that these 3 weeks that I've just been forgetting where I put my keys. I've been forgetting where I put my towel, where I put like little things, boxes of juices. I don't know. I just have pregnancy brain. But as usual, we are going to get right into it. Let's get started with week 30. Week 30 was tiring. Well, all the weeks are tiring because you guys know that I'm not getting much sleep. However, I am getting naps where sometimes I'm getting 2 hours in on a nap. So that's really well. And my daughter's actually sleeping for 2 hours as well. So that's even better. Because you know, with a toddler, now she's a toddler, not a baby, right? Because she's 1 year, she's not a toddler, she's a toddler, right? You know that they take 20-minute naps, an hour nap here and there. So when they up, you got to be up and all this, that, and the third. But for these 3 weeks, I've been getting a slight sleep, more than I used to get. So that's good in 2-hour intervals. But in week 30, my heartburn increased and actually increased from week 30 to week 32. I have very intense heartburn. I haven't been taking anything for it yet. I said if it does progress, because it's really hard, it really hurts, that if it does progress that I would take something for it, but I haven't taken anything for it yet. So, I don't know. I just had a lot of heartburn in week 30 and going through week 32. I'm sorry, I got heartburn now. Also this week I did vomit a lot. However, I'm not vomiting like I used to in the beginning with the HG. So that's a good thing. You know, I vomited the Chinese and I vomited. I was vomiting Chinese food and some other different things here and there. In the morning, I'm still throwing up. But you guys know I don't count that because I throw up every morning. But I'm not throwing up at night anymore. So that's really good. But week 30, I was throwing up a lot. Not a lot, but not a lot compared to what I used to. But I threw up a lot within that week. Also, as you guys know, I'm dealing with a lot of pelvic pain. A lot of pelvic pain, and it's only happening when I go to lay down and I'm turning and on my side, on my back. It's a lot of pelvic pressure and pain down there. I go to physical therapy twice a week. So I went to physical therapy this week 30, I'm saying. Twice a week. It was okay. He did some suctioning in my back and I told him I didn't like that, so we didn't do that exercise. My physical therapist, he seems to do different exercises each day to help me with the pain, but the pain is still progressing. So I did go see my chiropractor. So I see physical therapy twice a week and I see the chiropractor once a week. I did see my chiropractor and I changed over because I told you guys I didn't like the first one. So I did change it, and this one, she had a lot of information, she had a lot of techniques, and she's doing really well working on me. So I continued to go to her week 31 and week 32 as well. So I see my chiropractor once a week, like I said, and I did see them in week 30, and it was okay. You know, she said there's a lot of stiffness in my back. I was like, just tell me, is my back out of alignment? She's like, we don't like to use those words, but you have a lot of stiffness, a lot of muscles that are not moving the way it should be. And we're just going to try to loosen that up. And I know that's going to take time to loosen up, but each night I am in pain. I am in pain with my pelvic area. It is hard for me to sleep at night. Also in week 30, I had an appointment. So I had the baby checkup. Sorry. I'm getting over a cold. I had a baby appointment because I got every 2 weeks there's a new appointment. When I went in, I gave my urine. My blood pressure was 120/76. I weighed 175.6, so I'm doing good in the weight compartment. I'm trying not to get to 200, as you guys know. The baby's heart rate was 145, and my fundal height that I was measuring was 30. So everything went great with the appointment. They didn't find any protein in my urine. My pressure wasn't high. I wasn't swollen. No signs of preeclampsia or any, thing to make me go to the hospital or anything like that. So that went well. And the only thing I was craving for week 30 was chicken. Chicken sandwiches, chicken wings, chicken breasts, just chicken strips, just chicken in general was the only thing I was craving, which was a surprise because I haven't really had cravings except my lifesavers throughout the pregnancy. But I ate a lot of chicken this week, but it needed to be homemade chicken. Because I find when I go out and I buy something, it kind of makes me sick and wheezy and throw up. And that's probably why I've been vomiting, because I've been eating a lot of home cooked meals instead of store bought or fast food or, other restaurants. Sorry. And I noticed that was making me throw up. So going into week 31 and week 32, I did a lot of home cooked meals. So let's stay on week 31. Week 31 was not a good week for me. My sciatica came back, you guys, and the pain, it's only on my left side. It goes from my hip and the pain shoots down my left leg. Once again, it only happens at night. And the sciatica mixed with the pelvic pain was crazy. And on top of all of that, I was sick for 3 days. I had a cold, I had a runny nose, I had a cough, and I just was all over the place. I was dizzy. It was just really bad. I don't know if it's because I wasn't eating as much. I didn't eat as much this week. I already eat small portions, but I ate even smaller portions of food. I just didn't have an appetite. So I was on bed rest for 2 days. And it was not like I was getting any sleep. My siblings had my daughter during the day, and then my husband, had her during the night so I can try to get some sleep. But it was hard because every time I lay down, I have a lot of pain and pressure in my pelvic area. And they trying to say it's round ligament pain and it's normal, nothing's wrong. So I don't go to the hospital for it. But if it does increase, I am going to go. But it only happens at night. It only happens when I'm laying down. So I was in bed and I was in pain in bed. I had heartburn. This heartburn thing is really getting on my nerves. Certain positions give me more heartburn than others, like laying on my side gives me more heartburn. And I know we're supposed to lay on our side, but I have a lot of heartburn. And I'm not sure why, because I don't eat like big meals. So I don't know. If you guys got any remedies or anything for heartburn, let me know in the comments below. But I did go to physical therapy, but I only went one time this week instead of 2. I canceled one because I was sick. And so towards the beginning of week 31 is when I went to my physical therapy. And he had me doing some back exercises. Every time I laid on my back, it was painful. So we did different exercises, pulling things. And he introduced the ball into the physical therapy thing and had me sit, had me walk around. So like I said, every time I go, he tries to do different activities to see what is good. Sidestepping with the, I don't know what it's called, but I don't like physical therapy, to be honest with you guys. It's a lot of work. I'll be in pain, and I know he doesn't try to increase my pain level. Like, he tries to do it very moderate where it's bearable, but I was not feeling it. And then after physical therapy, I had scheduled my chiropractor appointment. So I went to see my chiropractor an hour after physical therapy. And the lady, she worked on my back, and there was still a lot of stiffness and tightness. And she did actually do some work on my pelvic area with the little machine thing, whatever they call it, putting pressure on me. So, and then I got sick, you know. So, it was just, sorry, heartburn. Week 31 was just not a good week. I don't know how I got sick. Luckily, my daughter didn't get sick. My husband didn't get sick, but I was just sick, coughing and runny nose and headache, and I was dizzy. It might have been because I didn't eat so much with the dizziness, but still, like, it was just not good. And then having to be in bed and not getting comfortable, I just couldn't get comfortable. Like, my physical therapist told me put a pillow in between my legs and wrap it with a blanket, or she tells me to sleep at a 45-degree angle, but that's not hasn't been working either. And I have an adjustable bed that adjusts my feet and my head. I just can't get comfortable. I don't know. And also for week 30 to 32, every single night I get up at around 1 to 2 o'clock and I go use the bathroom. So every single night, every single day, I get up between 1 a.m. and 2 a.m. and I go to use the bathroom, and that's when the baby is up and he's moving, and sometimes I don't go back to sleep till 4 and 5. But that is when my baby is up, and after he's up and kicks and does all his exercising at that time, I try to go back to sleep, but I can't. So it's just a mess, you guys. So that's why I said, like, I'm getting naps here and there, but I still need to get way, way more sleep. Week 32, I had another appointment because, you know, I'm down to the 2-week appointments. And when I went in, I went for my urine. My blood pressure that week was 124 over 82. Over 82. And I weighed 176, so I only gained 0.4 pounds. The baby's heart rate was 135. That's the lowest it's ever been. My baby's heart rate is always 145 or 140 and higher. So the lowest it's ever been is 135, but they said it was fine. However, when they measured my fundal height, I was measuring 33 to 34, and I didn't turn 33 weeks yet. So I'm measuring a week ahead. But she said everything is okay, it's fine. It doesn't really, I don't have to really stress about it or anything like that. But it was the first week that I'm measuring a week ahead, and it's the first week the baby heart rate was lower than usual. But everything else was fine. No protein in my urine, and I wasn't swollen, no signs of labor or nothing like that. So I was happy about that. I did go to physical therapy twice this week. He let me go early one day because it just became too much. And he didn't want to overwork me. He could just see that my pain level and my tiredness was at an all-time high. And I went to my chiropractor. So we're just trying to loosen my muscles and see. The chiropractor wants me to find out if the baby's in a breech position, because she said if it's in a breech position, then she is going to want to see me twice a week instead of once a week, so they can position the baby. So I have to find out when I go to my next appointment if the baby's breached or not. Okay. I'm so tired. And also week 32, the only thing I was craving was Lifesavers. So, and you guys know I eat that all the time. So that was pretty much it for week 30 and 32. I had sciatica, which is really, really bad if you know the pain. But sciatica was only in week 31. But week 32, I did have pelvic pain. So I'm having pelvic pain still. I'm having pelvic pain now. So I don't know if that's a baby's way of getting ready to come or what. I do need to exercise more because I have a lot of leg cramping that I'm seeing, and it's only on my left side, but I need to find a way to exercise more and drink more water. I'm not drinking enough water, I'm not drinking enough fluids, and I know that for a fact, but I'm trying, and it makes me throw up sometimes, so sometimes I don't want to drink it. Or it triggers me, you know, nausea. It just makes me sick. But I know I have to drink more, especially as, you know, we're getting ready to go into labor pretty soon. Here's the baby bump. Oh, gosh. This is the biggest I've ever been in my life. But here is the baby bump. Here is the love bump. Can you see? Let me back up. So this is the bump. Boom, boom, boom. I do have stretch marks. They're all over. There's some up here now, but still haven't found a cream that works best for me. But I'm gonna keep looking and keep trying different creams until one of them sticks. I am not in maternity clothes, and I will not be buying any maternity clothes because I'm so close to the finish line. Sorry you guys, my camera died. So let me just finish this quick thing. I was talking about maternity clothes. I'm currently not in maternity clothes, and I said I'm not going to buy any because I'm so close to the finish line. So, and the clothes that I have are big enough for me to wear. I have clothes, you know, in a bigger size from when I had my first daughter. So it looks like I am not going to be needing any maternity clothes. My rings are on. They are not off. I haven't had to take them off. My hands have not got swollen, so I'm happy about that. Sleep, as you guys know, sleep is scattered, but it's getting better, but we need to do a lot more better before we go into labor, because yeah, I need a good rest before I go into labor to be dealing with all that pain. And labor signs, no labor signs, no labor signs, no labor signs, no labor signs, which I'm happy. I just want to at least make it to full term before that even starts. And what am I looking forward to? I know I told you guys I wasn't having a baby shower, and originally I wasn't, and everyone wanted us to have it and they want to chip in to pay for it. So we are having a baby shower actually in a couple of weeks. Around week 35 or something like that, I'll be having a baby shower, which is so close to the baby being here. So I'm having a baby shower, and I will let you guys know how that goes. But other than that, that's how my week 30 through 32 has been. And you guys let me know how you're doing on week 30 to 32. Make sure you like, you comment, and subscribe. And I will see you guys at the next video. Bye.